properties. pleasant good morning to all participants from China, Indonesia, Singapore, Philippines, and the rest of the Asia Pacific. Welcome to the first of a series of webinars presented by the Association of Nursing Service Administrators of the Philippines in partnership with MindRay. The main purpose of this significant collaboration between these two organizations is to bring to you updates on the latest trends affecting health, its work environment, processes and systems, as well as the practices of the healthcare professionals. The organizers have invited speakers who are experts in their field, with topics carefully selected based on a chosen theme. For our initial presentation, our theme is entitled Technology and Innovations in High Acuity Nursing Care, Asia Pacific Perspective. The objectives are as follows: discuss a new wave of health technology for innovative solutions to address the demands in high acuity nursing care environment in selected Asia Pacific countries. Discuss the nursing care delivery model to align with the innovative technology. And value the significance of harmonizing holistic care with technology. We will be having our interactive session in the second part of this webinar. Please keep posting your questions at the question and answer box. House rules are being flashed on screen. For those who lose connection, you may rejoin us by using the same link. Please accomplish the evaluation form using the link provided on screen after the session. Certificate of attendance will be issued to all participants. This webinar has been applied for continuing professional development units or CPD at the Professional Regulation Commission, Board of Nursing, Philippines. Your moderator for the first part of this program is yours truly, Dr. Mariferis Pacabis, the Chair of the Nurse Manager Certification Program of ANSAP. To formally begin our webinar, we have three distinguished guests who will deliver the respective welcome remarks. From the Philippines, Dr. Rodolfo Borromeo, the Chief Nursing Officer of Manila Doctors Hospital and currently the President of the Association of Nursing Service Administrators of the Philippines. He will be followed by Madam Kai Wexin, the Director General of the Critical Care Medicine Group of the Nursing Equipment and Materials Branch, China Association of Medical Equipment. And last but not the least, Dr. Aliana Dewi, the head of the Indonesian Critical Care Nurses Association, or the ICCNA. May I now call on Dr. Borromeo for the first welcome remarks.
Thank you, Dr. Therese. Good day, everyone. Today marks another day full of excitement and learning opportunities for all of us, as we are about to witness another equally thrilling topic centered around technology and innovations in high acuity nursing care. This time we are not only going local but international as well, because we have speakers and guests all the way from China and Indonesia. With us this morning is our very own kababayan, Ms. Marieta Velasco, the Department Manager of the General Nursing Services of the Philippine Heart Center. Mr. Zheng Kun, the Secretary General of Chinese Society of Clinical Engineering, China Medical Association. Ms. Liao Yumei, hope I was able to pronounce it, the Deputy Director of Nursing Department of Kaohsiung Medical University Hospital. Also with us is Ms. Kai Wexin, the Director of the Critical Care Medicine Group of the Nursing Equipment and Materials China Association Medical Equipment. Dr. Aliana Dewi, representing Indonesian Critical Care Association. Of course, Ms. Yamilu of Mindray Infusion System International Sales and Marketing System Product Specialist. Well, the growing demands of the healthcare industry has moved various initiatives and innovation in all corners that gave rise to quality and safe care programs. But despite numerous process improvement activities, inefficiencies still exist with less impact and significant change happen. However, the vanguards of innovations in the scientists of healthcare industries have stepped up with practical solutions and recommendations to reach the desired care outcomes. Keeping up with the realities of the future is inevitable, and there's no turning back, as this will be the trend, especially in responding to accurate and efficient point of care requirements. Needless to say, we have started pushing more, and we will continue doing and creating solutions to provide excellent services to our valued customers. Being mindful of the challenges we're having right now during pandemic increases the level of fear and anxiety among our nurses. The high and complex situation as far as acuity of care can further impact safety, which should also be ensured to manage the safety of the patient as well. This indicates how relevant the topics that will be shared right now. Perhaps a glimpse of technology, point of care equipment like packet size ultrasound, AI that spots lung tumors, wearables like smartwatches, and many other breathtaking technologies that somehow will ease up the growing and uncontrollable health issues today. I know you're all electrified to listen to our experts in the fields. I guess I would have to end and welcome each and everyone in today's webinar. Thank you.
Madam Kai Wexing, please. Madam Kai Wexing.
Hello. Distinguished guests, distinguished delegates, ladies and gentlemen, and old friends, I'm privileged to welcome you together online to discuss a new concept which called the safety of critical care. Let me introduce myself. I am Cai Weixin, chairman of the Critical Care Medicine Professional Group of Nursing Equipment and Materials Branch of China Association of Medical Equipment. It's a great honor for me to address this conference as a representative of China. Nursing Equipment and Materials Branch of China Association of Medical Equipment was established in 2015. The professional committee has established 9 professional groups, including critical care group and so on. These professional groups play an important role in promoting the development of nursing care from many aspects, including providing learning and communication platform for nurses, helping nurses to master advanced equipment technology, carrying out public welfare activities, ensuring the safety of patients, and so on. The year 2020 has been a hard year for the world. People from all walks of life are working hard to combat COVID-19. The healthcare workers in particular have made outstanding contributions to the fight against the epidemic. In the battle against COVID-19, nursing staff were at the forefront, especially critical care nurses, who were the main force in the battle. Take China as an example. Among the medicine teams, sent by the nation to support Wuhan in 2020, there were more than 5,500 critical care nurses, accounting from about 21% of the total number of corrected nurses, and three-quarters of the total number of critical care medical staff. It can be seen that the critical care teams are playing an indispensable role in the fight against the outbreak. The critical care discipline has developed rapidly. In the future, we need to continue to promote the development of the discipline from the following aspects. First of all, safety management is the top priority of critical care. It's necessary to conduct standardized practice based on evidence to make nursing practice more standard and scientific. Secondly, it is necessary to pay attention to the nutritional support of patients. One of the goals that nurses should consider is to reduce the complication associated with prolonged bed riding through progressive rehabilitation activities. Finally, an essential part of critical care is the focus on psychological status of patients. Nursing staff need to carry out continuous research in comfort care, pain care, and so on to improve patients' mental health. The critical care medicine professional group will continue to strengthen international cooperation, expand horizons and cooperate with doctors to pursue the development of medicine. We will continue to discuss the forecast issues, security issues of ICU in order to improve the health of patients, maintain the safety of both patients and nurses. Thank you for your listening and wish this academic conference a complete success. Thank you.
Dr. Aliana, please.
Yeah.
Thank you, Mary. Thank you, Mary. Distinguished participants, ladies and gentlemen, my dear friends, all of you nurses in high acuity unit all over in the Asia Pacific region, I'm pleased to welcome you to the webinar with technology and innovation in high acuity nursing care Asia Pacific perspective. This webinar is a global academic platform linking experts from the Philippines, Indonesia, China, and Singapore to bring a clinical insight on sharing and learning the newest technology in the market to ensure patient safety in high acuity care. I'm sure we will also reach out to many new friends, practitioners, technologists, innovators, business professionals, and civil society representatives. A warm welcome to you all. Dear colleagues, we are understanding in the importance of science, technology, and innovation in our day-to-day lives and how they transform the world. Critical care nursing is expected to play a more significant responsibility role shortly. Effort to address the growing demand for nursing care lie in a more efficient and effective care delivery that also implies clinical professional and patient engagement with technology. The process of decision making in critical care nursing is particularly challenging today, especially with patient experience life-threatening condition and complex chronic condition. If this were not clear earlier, it is blending apparent now is the time of the COVID-19 pandemic. Science, technology, and innovation are indispensable for our response to and recovery from this crisis, especially for nurses in critical care. Distinguished participants, this webinar is organized by Association of Nursing Service Administration of Philippines and supported by MINRE. This webinar is an effective plan and a fast one, and the time available to us is limited. But we have also heard from through your response to our online survey. Your input must appreciated and ladies and gentlemen, by participating in this webinar, we are in the right place and in the right time. Together, let us accelerate the exchange of ideas, scaling up of accessible as a acceptable nursing practice. I'm confident that you will find new ideas, fresh energy, and novel partnership to sustain your efforts supporting the technology and innovation in high equity nursing and recovery from COVID-19 through science, technology, and innovation. I wish you all a very successful webinar. Thank you.
Thank you so much, Dr. Borromeo, Madam Kai Wexin, and Dr. Aliana for those warm words of welcome. I am now honored to introduce to you our panel of speakers based in the order of their presentations. Our first speaker will talk on bioengineering and nursing. He is a certified clinical engineer, a fellow of Ohio State University affiliated hospitals, the Secretary General, Chinese Society of Clinical Engineering, China Medical Association, the Vice Chairman of the Chinese College of Clinical Engineers, China Physicians Association, a clinical engineering teamwork awardee given by the International Federation of Medical and Biological Engineering, and currently the Director of Logistics Support Department, Zhejiang University School of Medicine, Hangzhou, China. Ladies and gentlemen, Mr. Zeng Kun. Our next speaker's topic is on care essentials from infusion to ventilation. She is a former head nurse at the Cardiovascular Surgical Ward and Burn Center, Kaohsiung Medical University Hospital. She's also a former nursing supervisor of Critical Care Unit, Kaohsiung Medical University Hospital, and currently the Deputy Director, Department of Nursing, Kaohsiung Medical University Hospital. Ladies and gentlemen, Madam Liao Yume. Our third speaker will talk on harmonizing technology in high acuity nursing care environment. She was the acting Deputy Executive Director for Nursing Services, Philippine Heart Center. She acted as the President of the Society of Cardiovascular Nurse Practitioners of the Philippines Incorporated for a period of time. She was awarded as a model manager and model supervisor by the Philippine Heart Center. She is a certified assessor of the Department of Health Nurse Certification Program in cardiovascular nursing, as well as a cardiovascular clinician 2 by the Board of Nursing, Philippines. A certified level 5 nurse manager, as well as fellow of the Association of Nursing Service Administrators of the Philippines, and currently the Department Manager, General Nursing Services of the Philippine Heart Center. Ladies and gentlemen, Ms. Marieta Velasco. Lastly, to join our panel of experts in the interactive session, we have a guest in the person of Madame Pan Ning, the head nurse of the Coronary Care Unit at the National University Hospital of Singapore. We're now ready to listen to the presentations of our speakers. Let us hear from Mr. Zeng Kun.
Thank you, Chair. Thanks for the organizer. Please allow me to share my screen. Please allow me to share my screen. Chair.
Sherwin, please. Sherwin.
Can you hear me? I can't
Sherwin.
share my screen.
Sherwin. There.
There we go.
Yeah. I hope that's okay, Mr. Zong.
I need to find my, just a minute. There we go. Yeah. Thank you. Thank you again. Hi, everyone. Good morning. This is Zheng Kun from Children's Hospital of Zhejiang University School of Medicine, Hangzhou, China. It's my honor and pleasure to deliver a speech in this seminar. I've been working in the clinical engineering and information technology management at the hospital for over 30 years. My topic today is bioengineering and nursing, teamwork approach to promote safety and quality control for medical devices. My disclaimer: opinions expressed are solely my own. Products shown or mentioned are for educational purpose only. I'm using my clinical engineering career experience in this presentation. However, no institution or myself endorse, recommend, nor exclude certain products and don't take any responsibilities nor liabilities for the content of this presentation. This is actually my last slide, which concludes the takeaway principles about the healthcare technology management, HTM, applied on the content and the case example of my speech. But I'd like to talk about it now, then go through my presentation and back to this slide again. To ensure the safety and quality of medical equipment application in healthcare delivery, we believe a teamwork approach is fundamental. And to guarantee a successful implementation, the following 4 HTM principles, namely teamwork, in particular with nursing, hospital administration engagement, information and communication technology, ICT assisted, evidence-based, and system-focused are the key. The hospital where I'm working is one of the top best children's hospitals in China. From this slide, we know this is a very larger, busy, and modern hospital with 1,300 operating beds, more than 3.3 million annual outpatient and ER visits, and nearly 40,000 surgeries. It's also a base for 2 Chinese national centers for child health care and research. A lot of top technologies are applied to treat complicated and critical disease in my hospital, such as ECMO, surgical robots, and organ transplantation. The technology support team consists of clinical engineering and medical professionals, including nurses, play an important role to ensure their safety and effectiveness. The in-house clinical engineering program in my hospital has been conducting more than 35 years. Here are a few snapshots to show our staff are competent, striving, and with international orientation. And this is a team-led translation and publishing of World Health Organization's Medical Device Technical Series. This series includes the following subject areas: policy framework for health technology, medical device regulations, health technology assessment, medical device innovation, research, development, and health technology management, including needs assessment, procurement, donations, inventory management, maintenance, computerized maintenance management systems, nomenclature. These documents are intended for use by clinical engineers, health managers, healthcare givers, donors, non-governmental organizations, and academic institutions involved in health technology at the district, national, regional, or global levels. This year, the photo shows we welcoming WHO Medical Device Senior Advisor, Ms. Adriana Velasquez Blumen, to visitors. And this is the clinical engineering staff manual. And this is the medical device use guidelines widely distributed and propagated in the whole hospital, which gives guidelines of medical equipment risk and safety considerations of electric, mechanical, radiation, biohazard cautions. The safety operation guidelines for common devices such as patient monitor, infusion pump, defibrillate, ventilate, etc. in clinical settings. The emergency preparedness, adverse events, and recall management. And this shows our department monthly seminar. And the lecturer in this picture is the vice president, at that time, vice president of Acuity, James Keller. And this is a medical device orientation training for all new hospital employees. Routine medical device safety and quality management, where to start? Here is a good example. Acuity is the most trusted voice in healthcare, in particular in medical device evaluation, safety and quality control, adverse events investigation, etc. As an international respected patient safety organization, Acuity published annual top 10 health technology hazards since 2007. This is just released the day after before yesterday, published list for the year 2021, mostly based on the COVID-19 pandemic. This year's top 10 health technology related concerns are EUA devices management, drug name auto display, telehealth adoption concerns, consumer-grade devices, UV disinfection, software vulnerabilities, artificial intelligence in diagnostic imaging, remote operation risks, and the concerns for 3D printing qualities. My team did a summary and analysis about all concerned events from the published top 10 hazards from 2007 to 2020. And we classified all events into several categories. As shown in this slide, the alarm fatigue issue, hospital-acquired infection issues, information technology issues, and specific medical devices issues, etc. Here are the summaries of the same event or issue repeatedly appear on the annual ranking lists: alarm fatigue, radiation hazard of radiotherapy and CT, improper rehandling of endoscopic equipment, error in using infusion pump, operating room fire, injured caused needles and other sharp devices, medical IT system failures, etc. Considering this, with the hospital status quo and the clinical engineering system data, list some area or specific medical device, such as infusion pump, which I will talk about later as a case example, is a good start point for annual medical device safety and quality management projects. We established and applied this model for medical equipment safety and quality control. The key points of this model are through the multidisciplinary teamwork approach based on the clinical use safety and quality committee, which consists of all the key representatives of stakeholders, such as hospital leaders, clinical engineering, physicians, nurses, quality safety officer, and so on, and also clinical engineering department. And based on the established updated policies and procedures, through different assigned role players, such as the medical equipment managers, mostly nurses, and clinical engineers, technicians, and manufacturing engineers. And they all do their part. And through the multi-team approach through the communication, collaboration, and commitment to ensure and to safeguard the patient safety. And based on the above mentioned safety and quality control model, take the infusion pump as an example. In program implementing, 3 important on-site role players are designated medical equipment managers, mostly nurses, and in-house clinical engineers and technicians, and along with the manufacturing engineers. Medical equipment managers in charge of performing infusion pump daily operation verification, cleaning, disinfections, and reporting failures if there are. In-house clinical engineers and technicians perform the routine rounds, schedule the preventive maintenance, quality inspection, and troubleshooting as needed. And manufacturing engineers provide their expertise support when needed. By doing so, all players do their due part work for the safe and effective use of infusion pumps. And with information and communication technology, ICT assisted tools such as CMMS, computerized maintenance management system, and end user terminal equipment, every infusion pump has a QR code. By scanning it, as shown in the figure 2, the authorized users can access pump's profile, maintenance history, quality control data, and operation guidelines, etc., and also can issue a call for troubleshooting as well. The figure 3 shows that the clinical engineer or the technician will receive the troubleshooting request, and the quality control data, as long as a reminder for next inspection, will send to the clinical engineer as shown in the figure 4 and figure 5. The CMMS system facilitates the management and tracking of equipment status and quality control information. We implemented this program for several years and reached some progress. Take some relevant safety and quality metrics as listed in this table as example. With interventions and continuous performance improvement, the pump's failure rate and the incidence of related adverse events are dropped, while the pass rate of quality inspection improves. Yet, comparing with the top performance in the field, for example, with 90+ pass rate of quality inspection, we still need continuous PDCA. As an analysis of adverse events has the potential to identify problems that can help the clinical engineering. For example, errors of use should guide to observe the level of training for users and give feedback to manufacturers for product improving. And in the case of reports of flow rate problem, guide the clinical engineering for enhancing periodic performance tests and maintenance. And here are some photos show the combating COVID-19 in my hospital. This is the youngest COVID-19 patient, Qing Qing, who was only 3 months old when she was admitted in the first phase outbreak of the epidemic in Hubei province. And 20 days later, she was cured and discharged from my hospital. And clinical engineering, along with healthcare professionals, work together to take care of COVID-19 patients and other patients as well. In combating COVID-19, a lot of new technologies are widely used in China. Just name a few: telemedicine. This is a telemedicine center in my hospital. Artificial intelligence, big data, robots, 5G, etc. Furthermore, I observed and witnessed several innovative tools developed by frontline nurses and clinical engineers, such as patient monitor, CT, remote operation and monitoring, patient tracking and guidance, smartphones apps, the COVID-19 mobile sampling room, etc., all aiming at reducing potential virus exposure. As medical equipment, one ventilator leaves me deep impression. The SV300 ventilator is lightweighted, less than 10 kilograms, with 4 capacities for COVID-19 patients, from non-invasive ventilation to invasive ventilation, from high-flow nasal oxygenation to 4 modality mechanical ventilation modes. It's an excellent model of one-stop solution for COVID-19 patient. In conclusion, to ensure the safety and quality of medical equipment application in healthcare delivery, we believe a teamwork approach is fundamental. And to guarantee a successful implementation, the following 4 Htm principles are very important. Teamwork, in particular with nursing, clinical engineering, and nursing, we are interdependent for accomplishing our common tasks to ensure patient safety. The other 3 important principles are hospital administration engaged, information and communication technology ICT assisted, and evidence-based and system-focused. Thank you. Stay safe and sound. Thank you all very much.
Thank you, sir, for that very informative lecture. Allow me to emphasize some points of the lecture of Mr. Zeng. First, that teamwork is a significant factor, especially in nursing, in the promotion of safety and quality control for medical devices. 2, that a quality control system for medical devices must be installed in every hospital that would include an organizational structure, policy and procedures, and quality control network that focuses on communication, collaboration, and commitment among the multidisciplinary team. And with much relevance to this pandemic period, he emphasized the value and benefit of the use of the new technologies to combat COVID-19. Again, Mr. Zeng, thank you for those important inputs.
Thank you, Mr. President.
Thank you. Okay. We now go to Madam Liao Yu Mei's presentation. Madam Liao, please.
Hello.
Hi.
I
Hello.
can you speak?
Yes, we can hear you.
Everybody, good morning.
Good morning.
Good morning. Today I'm very honored to participate this care essential from infusion to ventilation and in this seminar. Today my topic is advantage medication error in the intensive care unit, infusion pump, root cause analysis, and its solution. This cartoon picture.
Hello, Ms. Liao. Hello, Ms.
Yeah.
Liao. Please share your screen. Thank you.
Can you see? Excuse me.
Yes, yes, we can see it now. We can
Yes, we can see it now.
Please share
Okay.
the full screen. Thank you.
Wait a moment. Okay, 全荧幕。
这个
我看不到他们。好，好。
你现在开始 share 了吗？
Can share me?
Yes.
Yes.
Yes, okay.
This cartoon picture is nursing is very busy. There was a lot of instrument and tubing on critical ear patient. Nursing role is very important. Clinical nurse work is very complicated. One day have a 1,007 action. If only 1% of error, one day have a 2 error. Human is error because of too much action and information. As a clinical care management must think how to facilitate our work, how to prevent error, how to simplify our daily work, and to prevent safety standard and reduce the healthcare association infection and so on. This picture is a emergent care research institute top 10 health technology hazard, for example, pump ventilation and so on. This 2050 and to 2060 emergent care research instrument top 10 health and technology hazard. For example, missing a lung, an infusion pump, medical error, and ventilator and disconnection. It's 2090 Emergent Care Research Instrument top 10 health technology hazard for 10 items. Improvement the setting ventilation alone put patient at risk of for hypoxic brain injury or death. And the confusion dose rate with flow rate can lead to infusion pump medication error. Clean fluid seeping into electronic component can lead to equipment damage and fire. For battery charge system and participate can affect device operation. This confusion dose rate in the flow rate can lead to infusion pump medication error. Factor that contribution to wrong field program error, including the layout of the infusion pump program sequence. Risk of medication error with infusion pump have many different kind of medical error. For example, 2090 years, a total event had 1,004 event. The most common subtitle of wrong medication error is IV rate and equipment. Most common factor contribution to red error is a port burn or tubing connector. The factor cause medication error is CNG pump have inclusion the incorrect infusion rate, medical damage part, incorrect medication dosage or concentration, inadvantage line break or software defect, and battery failure. Its clinical clean fuel shipping into the electronic components can lead to equipment damage and fire. So every equipment have a specialized for the clinical medication equipment software. For example, ventilator or infusion pump, and so on. In the Taiwan patient safety goal for the hospital, 2020 to 2021 years have improved the medication safety, enhanced the safety practice in the fusion of medication which require rate control or sharing line. This study in my hospital essential event analysis, advancing event analysis, a case of inadvantage medication infusion by CNG pump. 70 years ago, lady with pelvic fracture because of persistent severe pain over low abdomen region. The doctor ordered continued infusion of fentanyl kit at 15 microgram per hour via right subclavicle central line. About 1 hour after fentanyl infusion, she complained that pain back again. Then our nursing staff purged 1 milliliter of fentanyl filled with CNG pump. However, there was a long signal present CNG purge, where the purge of fentanyl around 0.7 milliliter. Our staff, the scene, it was central line occlusion. That central line pattern and poured by 1 milliliter normal setting irrigation, then receded 0.3 milliliter of fentanyl was tried purge again, but a long signal up again. After seeing examination of the line and tubing connect, they were found that totally 10 milli of fentanyl was missing. What's wrong? What's going wrong? Mechanical or procedure is wrong. This structure of common CNG pump. The safety use of infusion device, anti-siphon valve. You usually use the CNG device to reduce the risk of advantage-free flow. If the pump is more than 100 centimeter above the patient, the grade pressure can be greater than overcome the fuel between non-sequence purge boiler. Siphon can also occur the minima height between if there is a track in the CNG over air entry. CNG device should therefore not be positive position above the level of the patient. Some modern pumps have a function called back-off, which protect against post-occlusion bolus. Siphon function for CNG device can we must be check the crack in the CNG, ensure CNG barrel and project firmware and engage the machine. Position device can same level as patient, ensure present the anti-siphon valve in line. Post-occlusion bolus ensure release the include line pressure before release obstruction. If device have no back-off facility, ensure present anti-flat valve in the second line, so as avoid risk backflow and subsequent bolus. In the organization level, to ensure safety, use the infusion pump procurement device standard measure not more than one type of each device, and all member or staff should be device training and regular maintain program. This is meant to analyze the cause of CNG pump error. This way, this monitor have 3 milliliter per hour. It's CNG. It's central line to patient. Patient central line is a cushion or clamp. Its pressure cannot lift to the central line. So now this in the purge, a bolus, the infusion. The monitor show occlusion around. It see in the nursing release the occlusion central line. If not whole pump patch grade, its solution is as soon as come to this way. This infusion sucker empty. The structure of common CNG pump. If there is occlusion account, long signal present a long sound display occlusion detector, increase pressure inside the line. If detect remove the cause of occlusion, maybe induce the siphon effect. If the punch grade not correct place, the situation will be greatly. How high the pressure will be in the situation of occlusion. Normal infusion pressure in adult from 1040 mmHg. Occlusion pressure around 0, about 300 mmHg. In this case of occlusion, the pressure may up on to more than 300 mmHg. Solution. Lower the pressure inside the tubing or line. Correction plate Fax Viewer will use the syringe pump and follow standard operation procedure. If there is occlusion present, we have a 3-step and can do it. The first step, close the clamp of the tubing or line. Second, remove the solution of the occlusion. Then open the clamp or release the fragile grape from the purchase and the clamp tube or line at the same time. Take home message. Infusion pump medication error are common. Need training. Establish standard operation manual. Prescription format made simple. In the future, the smart or auto program infusion pump may reduce the missing event. In the era of COVID-19, the wellness control and monitor of infusion pump will be help. Thank you for your attention. Okay.
Ms. Teresa, unmute your microphone.
Sorry. Thank you, Madam Liao, for that interesting talk on devices and the errors that can affect their efficacy. Madam Liao's presentation focused on how advanced technology with the use of machines like infusion pumps, ventilators, cardiac monitors, and others help the nurses considerably by simplifying and facilitating their tasks and making their daily work lighter. However, the nurses must be aware of the risk of the use of these machines if not cared for or maintained properly. Examples were given such as alarms that can cause brain damage, flow rates that then cause medication errors, or software defects, battery failures that affect the safety of the patient. She also emphasized measures to ensure the safety use of these equipments, from procurement of the equipments to training of the staff and the maintenance of these machines regularly. Again, thank you, Madam Liao. We can now proceed to our third speaker, Ms. Marieta Velasco.
Thank you, Ma'am Therese. Good
Yes,
morning.
good morning.
I would like to thank the association for inviting me on this webinar. My topic is harmonizing technology in high acuity nursing care environment. For my disclaimer, the information expressed in this presentation are the product of personal study, review of related articles and interviews. The specific equipment described in the presentation are currently used by the Philippine Heart Center and are not specifically endorsed by the presenter. I am not in any way affiliated with the company Mindray, either business or personal. My discussion would include Philippine Heart Center Nursing Service, an overview, definition of terms, framework of nursing care delivery, equity in nursing care, technology in healthcare, and lastly, harmonizing holistic care with technology. The Philippine Heart Center was established and inaugurated on February 14, 1975, as an institution committed in caring for patients with heart and related ailments in the ASEAN region. It has 462 functional beds and continues to expand its inpatient and emergency room. For 46 years, it has remained the primary referral center for patients with cardiovascular diseases all over the country and the primary training center for cardiovascular specialties, namely cardiovascular surgery, adult and pediatric cardiology, cardiovascular nursing, and other allied specialties in the Philippines. At present, we have 8 ICUs, 2 for pedia and 6 for adult patients, with 116 beds total. And for our workforce, we have 35 nurse managers, 776 staff nurses, and 224 nursing attendants. To standardize the understanding of the terms used in my discussion, the following are defined. One is technology. These are items, machinery, and equipment that are connected to knowledge and management to maximize efficiency. These are skills, methods, and processes used to achieve goals and solve problems, can be used to make humans work easier, the knowledge of how to use it, and the ability to convert it into nursing practice. What about high acuity unit? It's the unit in the hospital where patients with life-threatening or serious medical issues are provided with focus, round-the-clock care by highly skilled medical staff. Patient acuity, on the other hand, is the intensity of care provided to a patient by a registered nurse. The use of patient classification systems that can forecast patient care requirements to manage nursing personnel. And lastly, harmonize, it means reconcile, to agree, accord, to be combined or go together in an effective way. The framework here describes the 3 concepts in the delivery of nursing care. Technology has been widely used in different sectors. In the healthcare industry, utilization of technology has been increasingly seen worldwide as it addresses the needs of patients and monitors them in the most effective and efficient means. The high acuity unit, as defined, is where patients present challenging medical conditions and often have significant unpredictable needs where they require holistic care, free from any potential harm or injury, and where healthcare providers are assigned with the ability to make critical decisions for the patient. These two, when blended together by a high acuity nurse who provides compassionate, knowledgeable care that is precise, prompt, and professionally delivered, will lead to better health outcomes. And this will be discussed extensively in my succeeding slides. This is a sample of a patient in a high acuity unit with special needs. They have complex clinical problems. They are clinically unstable, had major surgery, accident, or trauma, perhaps with multiple organ failure. And what does they require? They require invasive monitoring, continuous nursing assessment and evaluation, continuous adjustments of treatment, safe and quality care, infection control and safety management, maintenance of skin integrity, and proper nutrition. Now, the care provided are measured and evaluated by looking into some healthcare indicators such as hospital length of stay. In our hospital, post-operative coronary artery bypass graft patients stay at surgical ICU for 3 days, utilizing the clinical pathways. Other indicators are morbidity status, risk for infection, risk for complications, and safety and quality indices such as zero errors in medication management processes, procedure, and patient identifiers are emphasized. And for the quality aspect, this includes satisfaction evaluation of care delivery as perceived by patients and their family. In the Philippine Heart Center, we conducted a time and motion study way back in 2009 and 2012 to establish patient classification system and to categorize patients according to the amount and complexity of nursing care requirement over a period of time. We utilize an equity of care tool where we score our patients based on 8 care descriptors with 100 points distributed to nursing care provided. This include direct care, assessment and monitoring, medication and IV therapy, nursing procedures, communication, safety precaution, general status of the patient, and behavior. The points are summed up to identify the patient level of care. Patients in the high acuity unit are mostly in levels 3 and 4 categories, which demands higher staffing requirements. The highest acuity level translates into a typical nursing ratio of 1 is to 1 nurse is to 1 patient, or 1 is to 2, 1 nurse is to 2 patients. Let me describe you now our patient classification. For our level 1, the self or minimal care with 0 to 30 points, these are stable patients able to perform activities of daily living by himself or with minimal assistance. Second, they require nursing assessments and vital signs are taken every 4 hours. They require minimal and nursing interventions. For our level 2, partial or moderate care with 31 to 60 points, they require moderate assistance in performing activities of daily living. Nursing assessment and vital signs monitoring are taken every 2 to 4 hours, and they require moderate nursing and medical interventions. For level 3 or total care with 61 to 90 points, patients require total nursing care. They require nursing assessment and vital signs monitoring every 2 hours. They require extensive nursing and medical interventions. These are for chronic critically ill patients who needs life-sustaining medical equipment and medications. And lastly, our level 4, intensive care with 91 to 100 points. Patients require nursing assessment and vital signs monitoring every 15 minutes to 1 hour. Mostly these are immediate post-operative patients. Requires continuous nursing and medical interventions, which includes, I've mentioned already, the post-CV surgery, post-CP arrest with continuous hemodynamic and monitoring lines. Now, nurses in high acuity unit, nurses in high acuity unit has a major role to fulfill in order to blend the complexities of care in a high acuity environment with that of medical technology. He or she must conduct a thorough assessment and sees beyond vital signs, correlates the reflected values on the monitor with that direct evaluation of the patient. So she functions based on her intellect and not merely relying on devices, anticipates events based on her knowledge of normal physiology and patient's clinical condition, and she never stops gathering clinical data to answer the question why, and always collaborates with the rest of the healthcare team. Aside from focusing on the clinical aspect of care, we as nurses should also prioritize the wholeness of the patient, where we preserve the human integrity of the body, the mind, the spirit, and the psychosocial realms. Now, let's talk about technological innovations that can be grouped into 4 categories. Innovations that are monitoring, innovations that are interventional, technologies at a distance, and technologies that manage information. I have here some samples of technological innovations that we have at the center and mostly found in high acuity units. Cardiac monitoring system, telemetry monitoring system, COCI monitoring system, and we have the impedance cardiograph. The impedance or the computerized impedance cardiography permits non-invasive repetitive determinations of cardiac output in short intervals. We have also the blood warmer and the warming machine for pediatric patients with hypothermia problems. We have the integrated hospital system. This was procured and implemented in our hospital, which processes the database management systems that provide clinical, administrative, and financial information as a single source of data. Then we have the Fax Viewer. This is a picture archiving and communication system that enables clinicians to effectively view and interpret images. We should remember that advanced medical technologies are tools in medicine useful for assessment, diagnostic, and interventional applicable and appropriate to patients' needs. We as nurses are primarily responsible for managing the explosion of new technology. Nurses should manage technology and not merely employed in healthcare as simply the end users. As nurses, we decide what we require in partnership with our patients, looking at their needs so we can provide the necessary specifications in purchasing a certain equipment. Nursing should drive technological advancements in human caring. Recently, I conducted an interview among the ICUs and ER nurses of the Philippine Heart Center, about 19 of them, to look into their perspective on the effects of technology in high acuity units, and I divided it into 5 themes. Number one, effects on patient safety. Technological advancements, if handled correctly by trained and skilled nurses, is expected to make treatment more secure, safe, and free from errors. Second, effects on provision of quality care. Medical devices are used for preventing, diagnosing, and treating diseases. It aids in describing the total clinical picture of the patient and helps nurses recognize abnormalities early that warrant prompt management. Third is effects on work performance and efficiency. Technology accelerates the completion of nursing duties, eases daily nursing routines, simplify work processes, and help nurses support independent work. This decreased fatigue and their workload, resulting to job satisfaction, improve nurses' confidence, and increase motivation. Fourth is effects on health outcome. Technology can ensure better health outcomes as it helps nurses with real-time recognition of cardiac waveform changes, allowing timely response and interventions leading to decreased morbidity and mortality. And lastly, effects on communication. Communication among healthcare providers is improved as the multidisciplinary team collaborates with each other where referrals are made comprehensively. Remember that advancement in technology is most effective when used to highlight the skills and intelligence of its creator. Harmonizing holistic care with medical technology starts with answering the question why. We should know why technology is important, why holistic care should be blended with the use of technology. Nurses should demonstrate adeptness with technology and understands its impact and be mindful that caring has outcomes. So let me share with you 4 ways. Number one, competence and confidence building. It is important for nurses to have proper education and technical training to stay abreast of new developments in science. Familiarization of the different equipment also requires reorientation, retraining, and continuing updates. There was a study that describes technology has of three indicators of caring, which are number one, nurses should have knowledge and skills. Number two, being on time. And three, managing equipment skillfully. Second, conscientious and ethical use of medical technology. Nurses should apply acquired knowledge on technical upgrades with the holistic care of clients in mind. We use technology in a way that is congruent with our professional identity as it reflects ethical practice, integrity, respect, advocacy, and safe quality care. Third, we should be active participants rather than passive observers. I believe nurses are driving force in healthcare industry as we need to remember that we're not robots working on machines, but active participants as we continue to pursue studies, research on new trends and practices. Technology should be based on the ideas and creativity of nurses. And lastly, keen attentiveness to patients' experience and technological devices. As nurses, we should be knowledgeable on correlating the reflected values with that of the direct clinical assessment of the patient. Nurses must keep patients' inherent uniqueness at the center of their assessment and interventional efforts. The danger happens when technology is prioritized over patient. So let's create a balance to prevent dependency on speed up tools. Nurses must manifest the very core of compassionate care, highlighting the day-to-day interactions and rapport building with patients. Yes, we know technology is pushing the healthcare industry forward, and that advancement in medical technology is inescapable. But it should serve as a helper, partner, and not to replace the clinical eyes, the critical mind, the compassionate hands of the nurse practitioner. To sum up my discussion, let me propose four keystone actions as we continuously face technological explosion and challenges in our inner core as nurses. One, acknowledge rapid technological advances and patient with complex problems. We need to recognize that technology is an indispensable part of nursing profession that facilitates nursing care. And that at the same time, we need to realize that patient care now has become more complex. Second, adopt the new technology in healthcare. We need to embrace technology since it's relevant and influential in the healthcare industry. We have to accept it and be prepared for its limitations. Third, acquire the necessary knowledge and skills. We need we should desire to learn. If we are not learning, we are not moving forward. So let's practice based on standards. And lastly, adopt continuously with the challenges that technology brings. Today's clinical environments are hectic, fast-paced, rapidly changing, and pushing clinicians to be highly adaptable. The challenge for us is to keep pace with the latest information and technology, continuously making adjustments for the patient. The Institute of Medicine Committee in 2011 predicted that nurses' responsibility is going to be an advisor of technological tools, information systems, and act as an interpreter for colleagues and patients. As I end, I'd like to share the impetus for Ms. Banner's involvement in nursing and research. In a highly changing healthcare environment, the core of the hospital is patient care, and the core of the core is the practice of the nurses who are with patients on a 24-hour basis. Whether the hospitals find itself in a time of strong or lean financial resources or a time of nursing shortage or surplus, the key question is whether in this era of highly acute patients, there are nurses who have an excellence of practice that can directly affect how a patient progresses to discharge and reduce unnecessary recidivism. Thank you and good morning.
Thank you, Ms. Velasco, for that very holistic discussion of your topic on technology and patient care. Ms. Velasco's presentation highlighted a nursing care delivery framework where she described the relationship of an ideal high acuity unit and the advanced technology. She stated that a high acuity unit has the following functions: that of providing holistic care to patients and delivering safe and quality care by nurse practitioners that utilize analytical decision making. On one hand, she emphasized that advanced technology serves mainly as a helper or a partner that can never replace the critical mind, the compassionate hands, and the loving heart of the nurse. When blended together, these two factors redound to better health outcomes of the patients. We can learn more from Ms. Velasco's presentation through your questions in our interactive session. We shall now proceed to the much awaited part of this webinar, the panel discussion, where questions will be duly answered by our esteemed speakers. For this part, allow me now to introduce to you my co-host who will handle the session. She is the former chief of the Division of Clinical Nursing Operations, University of the Philippines, Manila, Philippine General Hospital, and the and currently the chair of the Patient Safety Committee of ANSAP. My co-host, Ms. Maria Rita Tamse. Take it away, Rita.
Thank you very much, Dr. Pacabis. We are now in the second part of our webinar, and this is the interactive session where our participants all over the country and even in the Asia Pacific are afforded the opportunity to ask our distinguished panel experts or speakers clarification and validation of the various insights on their topics. There are two parts to this interactive session. The first part would be a panel discussion. There will be two questions to be asked to all panelists. And the second part will be how we will entertain questions from our participants. I would like to make mention of the fact that we have a fourth expert with us. She was earlier introduced by Dr. Pacabis, but I'd like again to mention her name. She is Madame Pani, the head nurse of the coronary care unit of the National University Hospital of Singapore. And we're privileged to have her with us. So for the first question for our panel discussion, again, I'm directing this question to our four experts. Dr. Seng, of course, Madame Liao, Ms. Pani, and of course, Ms. Velasco. The first question involves human dimension in technology and innovation. Innovations and technology involve shifts in mindset and behaviors among the staff in order to manage possible resistance that may affect patient safety. How did you effectively and efficiently communicate to your staff the changes brought about by the new guidelines that they need to implement? Please share the strategies you utilized. So maybe I can start with Mr. Seng Kun, followed by Ms. Liao, and then Ms. Velasco, and finally Ms. Pan. Mr. Seng.
Thank you, Maria Rita. If you allow, I might pass this topic. I will want to give some comments on the topic too. Thank you.
Yes. You will pass this topic. Okay. So can we hear from Ms. Liao? Yes, I guess Mr. Seng is an engineer and not a nurse, and a nurse can effectively answer this. So Ms. Liao, can we hear from you? I think she is muted. Can you unmute yourself, please, Ms. Liao? Please unmute yourself. So may I repeat my question? How did you effectively and efficiently communicate to your staff the changes brought about by the guidelines that they need to implement when you introduced technology in your institution? We all realize that there is a human factor every time we have changes in our institution. So can you please share the strategies that you utilized in engaging your staff to implement your guidelines? Ms. Liao, please unmute yourself. Are you having certain problems with your microphone? Can you please unmute? If there are certain concerns, I'll go back to you. Can we proceed with Ma'am Velasco?
Hi, Ma'am Rita. Thank you for that question. Thank you for that question, ma'am.
Okay.
As a nurse manager, first thing first, number one, know your people, know your workforce, so that you could prepare how to address their needs. In the Philippine Heart Center, ma'am, we have 80% of our workforce or nurses are millennials. And this
Okay.
group of people, this group of staff wants technology. Really, they want technology. They want advanced, the equipment and everything to ease to streamline work processes. Now, changing their mindset, changing their behavior starts with um, telling them or asking them or discussing with them why the question why this particular equipment, why this particular device is very important. That's number one. So know your people, how to address them. Number two is discussing with them the why, the importance of that technology. And number three, giving them assurance. Assurance means, number one, they need training. Yes, they're very excited to use that, but there's a danger in using the technology without proper orientation. So assurance of they will be trained. Number two, not only trained or orientation, they should be continuously retrained. Some of the equipment requires competencies, certification. So we need to use that. And lastly, you need to be with your staff nurses, coach them daily. Um, do not leave them alone in using that equipment if they're not really oriented yet. It takes time to be familiar with the equipment. Sabi nga, it was mentioned that practice makes it permanent. So when you practice, when you continuously use the equipment, it makes the knowledge and the skills permanent in you. So when you know that it is time for you to coach your colleagues, to coach your staff, your bedside nurses, and even your peers. So I think that would be my approach in addressing the shift in mindset and behavior of my nurses. Thank you.
Okay, you mentioned, you emphasize actually the fact that you have to communicate across generations because they have different ways of communicating. Is that right, Ms. Velasco?
Yes, ma'am. Yes, ma'am.
Okay, and that training is very essential. And coaching, which is actually part of nursing administration,
Yes.
coaching and mentoring. Thank you very much. So I would like to listen, I'm excited to listen to Ms. Panni. How do they do what they do in the Singapore?
Okay, hi,
About this.
good morning. Thank you for inviting me in this high the technology and the innovation in high acute care units here. It's very informative conference here, and then I would like to share my experience here also. First thing, when this question come out, the first in my mind is as a leader, as a manager in the units, you need to ask why we choose this equipment and the device. This is very important. What the purpose? Whether it's really useful and also good for just now our Vasasco, Ms. Vasasco already mentioned very important essential part is 4 parts. One is safety. Second one is quality of care. The third one is work performance efficiency. And then also the health outcome and the communication. This part is very important to we start to introduce a new technology or the device to our units. And then second thing, how we introduce it to our usage. And then of course, the advertisement so much, very good of the equipment, very good and the efficient of the device. And then we have to try first. So in our hospital, actually have one equipment or the quality evaluation community. This one is like a materials department. We introduce some device or equipment to our units. Okay. And then, of course, some of the units to try first, pilot the equipment or the device. and evaluate by the ground first. Should be really used by the ground, and then used by ground friendly, and then can use. You see, if ground nurse would like to use the equipment, of course, this one is just very good to introduce and easily to communicate to the nurse to use it. So this is a part, and then after the trial, we don't adapt the equipment immediately. We really need to go and then get the feedback from the ground. So different equipment, maybe few units, few departments use the ground nurse write the feedback, what the good part of the equipment or the device, what good bad, not advanced or not like which part. So when the feedback to the vendor, they may improve it. They may just do it better way to adapt the needs of the nurse on the ground work usage. This is the part we do it. And then after that, if we benefit, of course, attractive price also very important.
Of course, yeah, yes.
Right? It's very expensive, and then our manager will budget for the, this one also is a part we have to consider. So balance the effective of the equipment and also the price. We'll choose the best one. Maybe in the market, we will see which one very good. For example, just now I mentioned, I think just now Mr. Zheng Kun mentioned about the teamwork and the so-called what's that? Preventive maintenance. In the ground side, actually we struggle. Why we struggle? Because the equipment department try to find the equipment to do the protective maintenance, but cannot find the equipment. Where is the equipment? Of course, high in the market actually have one thing is very good. Every syringe pump, every infusion pump have one chip. The chip actually like a GPS can detect where is it, but very expensive. So we hope in the market have some things actually is so economically developed by our hospital, and then can actually, when we want the equipment, our unit the equipment missing, infusion pump missing. This one always have this problem. So we can say, use the GPS. Find the equipment, then find it. Why you find it, the equipment? In the details of the equipment, like equipment ID, have when should we do the PM? All is available there. This is in my mind to show, think about the, future equipment, or the future technology can adapt our hospital. This is part I think is good. And then, so talk about the training part. Training part actually, of course, so essential for nurses. So we are not the kindergarten teacher to teach the nurses, or we are not the spoon feed the teacher to teach the staff. Ask them and force them to learn. Learning is a self-driven process. So we try to in our mind also need to ask a lot of why in our mind. How to let them easy to learn the new equipment. Different people have different way to learn. Some would like to use the eyes to see. Some would like to write out, write down the material, then can remember. Some is like listen. So how to combine this all together? Let different type of the learner to benefit of the learning and the training session. So we have one platform for all the nurses. What we do, actually, we have an e-learning portal. That means even you at home, no need use the hospital internet. You can link, even you travel overseas also, you can link the e-learning, and then from the e-learning materials, inside of the materials, you can have the, just now, our Taipei Miss Liao shows the string palm 41 or the, actually this is one good thing. We can visualize the learning. So how? And then you can take the video to all the products, how this one function is. And then I also video myself. Then the whole process, all the equipment, how you do it, and then video down it. And then put in the learning materials. And of course, have SOP support. All the equipment used for what kinds of the patient. In our units, a lot of equipments like Impella, IABP, CRRT, dialysis machine, and also of beats monitor, and also of course ventilator is the essential one, and the different one. So in this situation, a lot of machine around the patient for the acute setting, and then how to ensure safety. This also essential. So how to prevent the error happen. This one is also how to reduce the workload of the staff. So I think the technology will going also. How to transmit all the data to the computer. No need key in manually. This one thing. Another thing, how the alarm work. Different alarm, meaning different is acuity. That means maybe life-threatening alarm, you must attend immediately. Different alarm, like volume to how to say, volume to be infused. The one that means you have to prime the line. So nowadays, how to do it efficiently and then help ease the nurses' workload and prevent the safety. This is the things we should think.
Right. Okay. Yes.
Okay. Yes. I think I better just stop here.
Thank you very much. Actually, you also answered number 2 question. But anyway, what is very important that you have emphasized is the feedback among the staff and doing the trial and testing of the equipment with them. And this is very critical because it is how they would respond and how they will regard the new technology. And I wouldn't want to not to mention the fact that you have also emphasized the importance of making them feel that this is assisting them in ensuring that patient outcomes will be better, right? And thank you very much for that. And I'm sure number 2 question will now be answered by Mr. Seng because it involves, procurement, training, and monitoring. So perhaps Mr. Zeng-kun, you can articulate more about the role of the nurse in terms of procurement, selection of devices and equipment, training and utilization of devices and equipment, and of course, the monitoring and maintenance. Mr. Zeng-kun, please.
Thank you, Maria Ritter. Before I give comments on the second topic, I just want to add something about what Ms. Panning just raised.
Yes.
Very interesting issue. And when we clinical engineers and technicians do the preventive maintenance, in the general words, it's that's a problem. Sometimes we can't locate the equipment and they are missing. So this is a very interesting topic, just like Ms. Penny mentioned. For some of the big ticket equipment like the radiation equipment, ultrasound, and some of the bigger equipment in the operating room, many hospitals nowadays, they use the real-time location technical For example, the RFID, the radio frequency identification. Yes, it's quite expensive. It's not cheap enough to expand to all the equipment, but the HTM, the health technology management, one main trend is to connect all the equipment online. And some companies are working on this, use their the cloud-based system, use some of the simple technique, but for the infusion pumps, because it's very, very large quantity in use in a hospital, still not connected on the net. I believe the clinical engineering, we're working on this issue. And so we'll solve later, not find the equipment when we're doing the preventive maintenance. Yes, it's very interesting. And as a topic two, I believe nurses are the main frontline caregivers and accumulate rich experience in medical device use. Therefore, their inputs for procurement and selection of the devices and equipment, training on the utilization, monitoring, and maintenance of device equipment are extremely important and valuable. They should have a big say in these aspects. As a matter of fact, take my hospital as an example. They have a chair in the hospital purchasing committee, as well as the clinical use safety and quality management committee, and contribute their valuable opinions in these issues. The committees value their inputs, in particular for commonly used medical equipment, such as patient monitors, infusion pumps, and some new technologies. I'm pretty sure that the total number, like in my hospital, about 1,000 infusion pumps, but we only with 2 or 3 makers chosen and used in my hospital. Nurse department plays a key influence in the decision. Besides, as a frontline caregivers, nurses are medical device directly upon patients. Therefore, the use, training, monitoring, and maintenance of devices and equipment are very important. Again, nurses work closely with clinical engineers and HTM technicians, and along with other medical professionals through communication, collaboration, and commitment to safeguard patient safety and play most important role in it. Thank you.
There's a follow-up question to you, Mr. Senkon. Somebody's interested. Are there nurse engineers assigned to help monitor vital devices and equipment in your institution? Have you recruited any nurse to become an engineer because of their interests?
That's a very interesting topic. As my presentation, I mentioned we use a mechanism that in the user department, we assign medical equipment managers, and mostly are nurses. And we will train her very intensively. And so allow her to understand a lot of the technical background of the equipment. And then it's her responsibility to train the other nurses in addition to the training organized by the clinical engineering department. Yeah.
So that's quite interesting. It means that they are also trained to understand as an engineer in terms of the nuances of the technology. Oh, that's very, very interesting. Yes.
Like just one example, like the defibrillator. And there's a synchronized defibrillation mode and the asynchronized defibrillator. And usually the doctors and nurses, they understand in which clinical situation they should apply these 2 different defibrillation modes, but they lack the technical background. And we just train the nurses. So the aim of the asynchronized defibrillation is try to release the charge on the RS, the Q ball, the wave. So otherwise, you may try to defibrillate the patient, but into another big trouble. Something like that, we will give them the explanation of the technical background. And so they can understand the technical background better, and they can maintenance and take care of the equipment better. And our common goal is for the patient safety. Thank you.
Thank you. Thank you very much. That's very interesting. So we move to the questions from the participants. I have the first question here. It says that many healthcare institutions may lack resources to migrate to the latest state-of-the-art equipment and devices. What other innovative schemes or strategies can be employed to reduce errors in healthcare delivery? So maybe any one of you can answer, but I'm interested in the answer of Miss Panning.
Can you just sorry just now quite fast the question.
Okay, let me repeat.
It again?
Yes, may I repeat the question? Many institutions may lack resources to migrate to the latest state-of-the-art equipment and devices. What other innovative schemes or strategies can be employed to reduce errors in healthcare delivery?
Okay. Yeah, we now Singapore is phase 3. We passed through the phase 1, phase 2 pandemic COVID-19 period.
Okay.
So in that period, we actually stand by. We must think further how much of the resources we required, and then how many beds our hospital can afford to admit those ICU status patient with COVID-19. So the whole MOH actually estimated how many ICU beds across all the Singapore government hospital, even the private hospital. So in this status, we short is not only equipment, we short of the skillful trained ICU nurses. So in this status, we massive training started from, I think, from March started. So from other departments, such as the not so essential department, general ward staff will step into attachment of ICU training. So then familiar with the monitoring and the environment, and then they can do as assistant nurse, help one RN. Maybe because in that case, we need a separate team A and the team B. So much shorter the staff in this situation. So one ICU RN, we just estimated to take care of about 5 or 6 patients, but with 2 or 3 assistant nurses. This assistant actually is qualified RN work in general work. But this situation never happened in Singapore because Singapore actually control very well and didn't overloaded of the ICU COVID-19 cases. Yeah, it's all the thing is under control. But in that period, every government hospital will deploy their ICU or general ward staff to infectious control center to support them. So this is a whole national champion to start this action. So this one is cannot you once you volunteer, the means is just do it. This is department support. Cannot say, oh, I have this equipment. Our unit also needs it. No, this one once faces COVID is a mission. We have to deploy the things out. Then lack of the general work state, the general work condition here, then we have to really solve by ourselves, short of staff, how we manipulate the manpower. That period is quite stressful. At the same time, the MOH may deploy some equipment, essential equipment, ventilator, and the dialysis machine to our units. So that machine and equipment is very strange to use by the nurses. How to use it safely? this is a very important part. So massive training again.
Okay.
But training may not enough. The staff also don't have confidence to just use the equipment newly trained it. So actually all the vendors of the equipment or device will come down to hospital to bedside support.
Okay.
Any troubleshooting will do it on time. And even 24 hours hotline is on. And the video call, because nowadays it's quite easy, it's like a WhatsApp. And then we can just video it, this alarm. And then the online, the vendor can just give the instruction how to do the troubleshooting. At the same time, not impact the patient's safety.
Yeah.
This is how we do it. Okay.
That's very interesting because you mentioned about human resource management and staffing, deployment not only of staff to areas that need them, but also deployment of equipment. What very interesting, another interesting thing that you have mentioned is the networking with the vendors in helping you maintain and make sure that the equipment are functioning well. Yes, thank you very much for that. That's very, very interesting. There's I saw Dr. Dewi Aliana. Maybe she can also share something from Indonesia about when you lack resources in getting into new technology, what schemes have you implemented or strategies to help reduce errors in healthcare delivery? Dr. Dewi, can you share with us?
Thank you, Maria. In our country, because Indonesia is huge people, isn't it? In a lot of variety, and because when a COVID-19, because the case in Indonesia still increased. Same in Singapore, we do the massive training for ICU nurses, training ICU, and we have every week we join the Ministry of Health to training ICU for the all nurses. And for the technology, we have a lot of new technology in Indonesia. We get a lot from Ministry and Health, but still less of training because maybe the equipment a lot, but for the training for the new resources is for the new supplier, they can come to every province in Indonesia, because in Indonesia a lot of province and they have not only bahasa, sometimes they're difficult to translate for the not only bahasa Indonesia, but for the safety, for the Milre, for Jakarta especially, we have new some like Philippine, maybe a lot for the ICUs, the same standard, but in Indonesia we have classification for the ICU, not only for the provinces, the fully the resource and the nurses is not lack of the resources, but for the district maybe we still can I think is not less for the resources in the district in Indonesia, because for the island is not internet, not good, something like that is not easy for us to develop the some stuff in Indonesian in the district island is the difficult for us. But is in the province is technology for the nurses. We still massive training and so we do it like something like that. I think it's the same for the COVID. The government do it everything for us.
Okay.
Yeah. So it's an engagement of everyone, every institution and stakeholder. So what is different in your area is that the deployment of equipment will be based on islands, because you have several islands, and that's very, very interesting. So now we move to the next question. This question is actually
yes, please.
Excuse me. Yes,
Yeah,
Mr.
I read a very
Seng
interesting and
Kun.
important
Okay,
question.
please,
In
please,
the
please,
Q&A. I try
please.
to give a quick answer. The question
Okay.
is, what do you think are the disadvantages of the use of a technology in nursing practice? That's the
Okay.
advantages outweighs the disadvantages. I try to answer this question through
Okay,
example.
so you're reading it
From
from the question Q&A box. Okay, yes, go ahead, please. Go ahead.
And during the difficult time in the outbreak of the COVID-19 epidemic, a lot of the hospital lack of the PPE, the personal protection equipment.
Okay.
And also they try to save the PPE and also try to limit the caregivers' exposure, virus exposures. And so the monitors might put outside the room of the patient and like an infusion pumps, use a very extending tube, and also even the ventilator.
Okay.
And
Yes.
save the PPE. But the disadvantage is this practice reduce the frequency of the caregivers have a close look at observe the patient's condition.
Yes.
So we need to balance. When we have enough protection, we shouldn't reduce the frequently rounds with the patient nearby. So actually, as a matter of fact, this is one major concern. So Acuity raised just during the top 10 hazard, technology hazard in 2020 when 2 days ago. Okay, thank you. We
So,
need,
okay.
my main answer is we need to balance. We need to make analysis about the disadvantages and the advantages. So depending on the different settings, we make our final call. Thank you.
Okay, so you're helping align and helping balance everything, the advantages and disadvantages. In fact, yes, there are also a lot of things that we have learned from this COVID-19, and that is actually the distancing from the patient. And equipment, presence of equipment will help us manage that. So now may I direct this question to Ms. Velasco. There's a question here about your patient acuity classification. The question is about what is your reference in the scoring of your patient acuity?
Thank you for that question, ma'am. Actually, I mentioned that different hospitals have varied acuity tools, and the hospital has a leverage to develop their own. What we did, we conduct a time and motion study. It's a real-time identifying or monitoring the activities of the nurse for a patient in the ward, for a patient in the ICU, so that we could identify how many hours is allotted to this particular activity. For example, IV medications, how many hours or minutes is allotted to that. Then we have a certain way of computing those. Then we come up with how many points or how many points is allotted for each of the activity for a patient in the ward, a patient in the ICU. That's why that's where we come up our acuity of care or patient classification.
Okay. Since you're at it already, may I now ask the next question? It's also directed to you. The remark here is, do you think rewarding nurses for using new technology will also help shape their mindset about it?
I was thinking what kind of rewards does Mr. Pangasinan is talking to. I think changing their mindset. Number one is rewards can be not in monetary or tangible things. Reward can be tapping them as preceptors. When that particular nurse have honed his or her skills, familiarized with the use technology, has the right knowledge, then that nurse can be a preceptor. That's a part of rewarding him, recognizing his expertise and making him as a coach to the orientees. So, and ma'am, we have in Heart Center, we have a Sampaguita Award. The Sampaguita Award, we recognize nurses for their patient care, for their commitment in the service. Perhaps that could be one of our criteria. Skilled nurses in the use of technology.
Yeah, okay. So sa Pagita reward is equivalent to the Daisy Award of in the US, is that right?
Yes,
okay, so I was reminded that we have last 5 minutes. So I guess this will be the last question, and this question is actually directed to Madam Liao, Ms. Panning, and Dr. Devi. Are there changes in the concept of holistic nursing care in your institution, given the increasing use of technology in healthcare? May I repeat? Are there significant changes in the concept of holistic nursing care in your institution, given the increasing use of technology in healthcare? Ms. Panning, can we start with you?
Okay, actually, we never change. Holistic care is essential to protect the patient's either is a physical or psychology or the spiritual health care. This one is very important.
Yeah.
Even with a high technology involved in, is like just now we mentioned, is a helper to help our nurses better manage the patient, better care of the patient, better outcome. Yeah, this is my point. Okay, short.
Oh yeah, so the bottom line is still better patient outcomes. Yes, I think we agree with that. And Dr. Devi?
Yeah, I think it's the same with Miss Manting. Is holistic care is nurse role regulation for nurse. Right? For the technology is make it easier for our working for the nurse and make a safety for us. I see it like that.
Okay, thank you, Miss Liao. I think we have lost her. I think these are glitches. Do we still have Miss Liao? Okay. So again, I'm reminded that we have to end this session. So before we end our interactive session, may I just give you a few significant points that our speakers have mentioned. We all know that the latest state-of-art devices and equipment, including telemonitoring systems, are considered game changers in the healthcare system or healthcare industry. The benefits of modern technology cannot be overemphasized. What is critical in healthcare now and in the coming years is the importance of harmonizing technological advancements with human touch. And majority of our speakers have mentioned this. We deal with patients who are highly stressed and anxious because of their healthcare challenges. A listening ear, a gentle touch, and the presence of the nurse are far more important. Patient-centered care anchored on teamwork and collaboration is still high in the agenda of holistic and safe care. Again, thank you very much to our panel of experts for participating in this interactive session. And we are not yet ending because we need to listen to the closing remarks of our ANSAP Institute Director. Let me call on Dr. Elsa V. Castro.
Thank you, Ms. Rita. I would like to thank everyone, especially the organizers of this webinar entitled Technology and Innovations in High Acuity Nursing Care, Asia Pacific Perspective. Thank you to our resource speakers who shared their experiences for our continual professional development for lifelong learning. Being healthcare providers, we are the driving forces for the provision of quality and safe care utilizing technology. To the officers of the Association of Nursing Service Administrators of the Philippines and the officers of Mindray, thank you. Mabuhay tayong lahat.
Thank you very much, Dr. Castro. Dear participants, may I remind you of the need to accomplish the evaluation. Please accomplish them online. In the chat box, you will see the link to our evaluation, and this will be the basis for the issuance of your certificate. Again, thank you very much, and may I invite you in advance to our forthcoming webinars on February on infusion therapy. March is a special month for us because we will celebrate again our we will have our annual convention. Please be there. And in April, we will have patient safety as our topic. Again, on behalf of the officers and members of the Association of Nurses Service Administrators of the Philippines, thank you very much to our experts. Again, we cannot describe our joy and delight in having you. And thank you very much to our active participants. Mabuhay, magandang hapo sa inyong lahat. Stay safe and healthy, and God bless. Salamat po.
Thank you. Have a good day.
Good day.
Thank you.
Bye.
Have a
Thank
good weekend.
Bye-bye.
Thank
Yes,
you.
bye.
Thank you,
Thank you very
panel.
much. Thank you.
Congratulations, my dear
Thank you.
panelists and
Thank you very
speakers.
much.
Okay.
Thank you.
Thank you, Mindray. Thank you, Yami.
Yes.
Thank you,
Can we
Roy.
invite you again next time? Thank you very
Yes.
much.
Thank you.
Thank you,
Thank
Yami.
you all. Thank you all.
Yeah.
Thank you.
Bye-bye. Bye-bye.
Bye.
Bye-bye.
Thank you.
Okay.
Thank you very much. Mama Liana, see you again. Thank you. See you again. Thank you. Thank you very much. Okay. Yami, thank you very much.
Congratulations again.
Thank you.
Thank you.
Thank you. Can we have another link for discussion?
Yeah.
Okay,
Sir
so,
President.
Yeah, sure.
Yeah, so we'll leave it na. We'll leave.
Nakikinig ba si ano?
Just a quick
Yeah, I
one.
think they are there. Yeah. Yeah, Sherwin, can you have another link for us?
Yes po.
Sandali lang
Thank
kami.
you.
Yeah. Thank you.
Yami, thank
Let's
you.
leave na.
To Mindray, thank you. Sir Roy, thank you.
Miss
Thank you.
Yami.
Thank
Thank you.
you.
Thank you, Rob. Thank you.
po, Sir
Next
Roy.
time ulit.
Thank you,
Bye-bye.
Thank you,
Thank you.
Miss
Miss
Rita.
Lou, thank you.
Thank
Please
you.
rest now so you will
Thank
be
you,
well.
Yami.
Happy weekend.
Happy weekend too. Happy weekend.
Have a nice
Bye.
day.
You too.
We
You
hope
too. Bye.
next webinar with you.
Yeah. Yes.
Yeah.
Very nice
Soon,
webinar.
soon.
Congratulations to all